repeat it, I suppose.
Sorry. So something I've been reading a lot about is how hormones factor into ADHD. So, for example, it can really exacerbate, well, in older people, like memory loss. Or so is that true as well? If the kids are going through, puberty, is that going to exacerbate the symptoms that you talked about before in terms of moodiness, behavior,
Sure,
that kind of
sure.
stuff?
So the question boils down to some sort of impact of hormones, particularly through the adolescent years. And first of all, Dr. Gersovich, being a medical doctor, would be a wonderful person to direct that towards at the end of this, if we can grab him. From a psychologist standpoint, so a PhD, not having gone to medical school, I can tell you that the research is showing that hormones can have an impact on whatever other condition, psychological, psychiatric condition a child may have. So what we essentially know is that when a brain is developing in an atypical way, whether it's developing in a depression type of way or a dyslexia type of way or a ADHD type of way, once the influx and raising and lowering of certain hormones, those can be difficult to regulate. And so those can lay on top of the symptoms that we're already seeing of the ADHD. So yes, there can be an effect of the ADHD symptoms can be impacted by hormonal changes. That doesn't mean that it'll stay. And oftentimes, particularly in girls, once those hormones can become more regulated, which can take 2 or 3 years post-menses, onset of menses, then there can be a better sort of regulation. What else?
Go here and then back there.
Hi. I wanted to ask a question about sleep. My son's ADHD brain is so busy that the moment his little big brown eyes flutter awake, whether it's 2 o'clock in the morning, 3 o'clock in the morning, 5 o'clock in the morning, he's awake. And it's very difficult to get him to settle back down. So I just wondered if there were any tricks that you could offer for helping the ADHD brain to sleep better and sleep longer.
Sleep is one of those things that is incredibly neurologically wired. And what we know is there are certain neurotransmitters and certain hormones that fluctuate throughout the night, and there are sleep cycles, and there are different chemicals that raise and lower throughout the night with different stages of sleep. Provided that we've done the behavioral things, like make sure they're getting adequate exercise, we're limiting, caffeinated or sugared beverages beyond 6 p.m., we are making sure that our child has a consistent time of waking up in the morning, that the bedtime and waking up times don't fluctuate too much on weekends, so within an hour. Good luck with that for your teenagers, but ideally within an hour. So if they go to bed at 9 on a school night, they go to bed by 10 on the weekend. If they're up at 7 on a school morning, they're up by 8, 9 on a weekend. If we can do those behavioral things and we're still seeing sleep disturbances, medications can be really helpful. So, and again, I have to be very cautious here because I don't have an MD, but what I can say technically is patients of mine have been successful with melatonin. Now that'll help with the onset of sleep. Sleep maintenance can be a little bit more difficult. The other thing I want to make sure to point out is there is a real chicken and egg issue here when it comes to sleep and ADHD. You look at the research, and a disproportionate number of kids with ADHD also have a sleep disorder. But people with sleep disorders also have hyperactivity, impulsivity, difficulty paying attention. Pretty consistently when I speak on ADHD and executive dysfunction nationally, someone will stop me and say, those are also all symptoms of a sleep disorder, by the way, Dr. Chase, so let's make sure that we're talking about sleep or whatnot. So I encourage folks to keep a sleep journal as best as you can, meaning what time you went to bed, what time you got up, how many times were you up through the night, what was your quality of sleep, do you feel rested in the morning? And don't be afraid to ask for a sleep study, because we can see if the rhythms are appropriate through the night before we start making an improper assumption that, oh, this is all ADHD. Oh, it turns out there was a sleep disorder all along, and we could have addressed the sleep disorder pharmacologically with medications, and now that the child's getting adequate sleep, we're seeing that some of the other symptoms are much more manageable. The last piece I want to add to that is, again, let's always go back to functional impact. It's not about diagnosis, it's about functional impact. And if it's not having a significant functional impact, so he's able to get through his day, it is, yeah, on the parent, yes, it is, absolutely. How old is your youngster that we're talking about? 12, okay. So, can he read a book? Can he play quietly? Can he engage in something on his own? If it's not having a significant functional impact on his day and on his life, he may be getting adequate sleep, and it may only be 6 hours, or it may only be 7 hours, or 5 hours, or something like that. So always going back to functional impact.
I believe we have a question right there.
You mentioned kind of ADHD processing and anxiety are often clumped together in individuals presenting with these symptoms. And that's how I've often seen my son, is having those issues. And he's been off of ADHD focus meds since the beginning of high school as a freshman, but has continued on Zoloft for anxiety. And when I've approached the issue of processing, I'm often told, oh, well, if he has an ADHD diagnosis, they won't do processing testing. So if you could speak to
Those people,
and
tell them they are wrong.
Yes. So if you could somehow tell me.
You can call here, Lawrence, you can call me. There's a million psychologists. We don't want to call anybody else but her and I, but you definitely can seek neuropsychological testing for whatever your concerns are. Again, functional impact, right? So, and I interrupted you, only tongue in cheek, did I? I'm sorry. Got a little impulsive.
I don't know if I'm on or off.
ADHD. So the bottom line is that if you have a diagnosis of ADHD, you have a diagnosis of ADHD. We want to know more about the functional impact, and we want to know what other things we might be able to do something about. And so certainly if a child has a diagnosis of ADHD, that may inform certain recommendations, certain things that we would do. You can go buy a book, you can go look at a website and start doing the things that are on there in the little bullet points. But if you want to get into the nitty-gritty and understand the functional impact for your child and the places and the interventions that you might want to do that are more targeted towards your child, testing can help with that. And testing can look at processing speed, it can look at reading rate, it can look at these executive skills, but then there's also other things. In fact, I just completed an evaluation a couple weeks ago, and we had the school meeting yesterday. Child has had an ADHD diagnosis for years, and all the academic difficulties have sort of been chalked up to, well, that's ADHD. Yep, well, that's ADHD. I evaluated the boy, did a thorough evaluation start to finish, because I don't know how to do any other type of evaluation but a thorough one. There are significant language deficits, like scores at the 3rd percentile language deficits, significant memory impairments, like scores at the 2nd percentile in memory, and significant processing speed slowness. So once you peel all that away, it's like, how the hell do you know this is ADHD or not at this point? Because these other areas that these executive skills need to function, we stay on task because we're talking to ourselves. I have to do this, okay, is that right? No, that's not right. Wait, I have to go back, that doesn't make any sense. Let me go back, I gotta do that again. That's our internal dialogue. If your language is delayed, your internal dialogue is delayed, and it's very hard to stay on task. So I would say to anyone who says, well, testing is futile, or we don't test or whatnot, I disagree with no respect whatsoever. Of course, with respect, but
We have a question up here and a
I
question.
think that gentleman has one. Wait, but
Oh, we have.
just because he's
Okay.
right there.
2 quick questions. My daughter, she's when she's at home, she's we view her personality as like full of life. We love it. But in school, she's disruptive. She shows a lot of the signs. We're concerned because if she goes on medication, is she not going to be the same? And that's a big concern that we have. And also, is it something that kids can grow out of? You know, she's, first grader, and obviously we want to do the right thing, but we've heard that kids have grown out of things like this, but we don't know. And obviously we're taking the right steps to do what we need to do. But I'm curious what your take is on those two items.
So two very common questions that I hear. The first piece is the good news about medication is that you will know pretty quickly whether or not you see a significant change in who she is, in her personality. And it's always a cost-benefit analysis. It always is. Is what I'm getting by medicating her an improvement in academic task persistence, less disruptive acting out? Is that worth what we're giving up in her personality? Is it worth it? And to be honest, and this is not meant to be a shameless plug, this is the truth, this school provides the right accommodations. So I have a child who goes here who has an ADHD diagnosis who's not medicated and doesn't need it because the functional impact here is mitigated by proper supports. That this school is not available, I mean, it's physically available to everyone, but not everybody can make the choice to send their child here, and I understand that. But it's always a cost-benefit analysis. Simply tempering her personality, if that even happens, and that may happen, but if sometimes we see that kind of fall away within a couple of weeks. As the medication gets in the system and they get used to it, they learn how to kind of still be who they are while on medication. You shouldn't see a drastic change in her personality, but you may see sort of if she's sort of like a kid who's always at the extremes, she might truncate a little bit toward the mid-range. It still may be worthwhile because the other kids are aware that this kid's disruptive and this is not a kid I want on my team and this is not a kid I want to work with in my group, and this is, so again, it's always a cost-benefit analysis. And really, that's only something that you guys can decide together. But I would get her feedback on it too. The second thing, do they grow out of it? Symptoms tend to change. They don't necessarily go away. So if she's, 6, 7 now? 6. Okay. So let's say she's 7. If she's 7 now, she will be better at doing stuff that's school-related in 5 years. She'll be better at it in 5 years than she is now. But she still may be behind her classmates. The things that we tend to see is rather than the disruptive, silly, hyperactive, out-of-seat type of behavior, we often see a shift more to the inattentive, dysexecutive, so difficulty being organized, difficulty following through on tasks, difficulty following multi-step directions. Do they grow out of it? Most don't, but their symptoms may change enough. And it's the hyperactivity that usually gets them on your radar screen. When that goes away, a lot of people are going, oh, phew. But then 7th grade hits or 9th grade hits, and they're going, oh my, what's this all about? And it turns out it's just a different expression of the same underlying disorder. I often think of kids who are hyperactive as like, thank goodness, now you're on our radar and we know what's going on, particularly girls, because girls often present much later into my office with academic struggles that are simply more the inattentive stuff, and they were never impulsive and hyperactive. Does that answer your questions? Sure.
Okay, I think we had a question back there and a question up here.
Hi, and thanks so much. This is really great. I'm not sure how I want to ask this question, so I'll just wing it here a little bit. Can you comment on tics, off meds and on meds? Is this something that you would see as this comorbid or this associated underlying thing, or is it something maybe specifically related to an anxiety or depression? I have a son who was diagnosed at age 6. He's 10 now, and he's gone from superhero shoulder pads to chewing on it or picking, somewhere. Thank you.
Is your child on medication?
Yes, he's on
Okay.
medication.
Stimulant
Does
medication?
it, he does it on or off.
Okay. So again, anything related to medication, I really want to make sure to defer to Dr. Gersovich if and when we have an opportunity to see him. Tics are they're often associated with a diagnosis of ADHD as well. ADHD is a very heterogeneous population. And I've said it before, I'll say it again. It's 18 symptoms. If you have 6 of this cluster and or 6 of this cluster, you qualify for the diagnosis. Nobody really is as concerned as to how you got those 6. So there is a subset of kids that just have excess brain activity. And that excess brain activity can lead to tic-like behavior or to tics. There's a lot of vocal tics. And they'll ebb and they'll flow. And so tics with ADHD is not uncommon. They often outgrow them. They're often harmless. And there are a lot of behavioral things that we can try and do. But I would definitely talk to the prescriber about it because over the years, the research has gone one way and then it's gone another way. But there is some evidence to say that tics can increase with stimulant medication. Again, it's all cost-benefit analysis. The good news is that in most cases, it's nothing we need to do a whole lot about. It has a social impact, but it doesn't hurt the child to continue the tic. What we can do behaviorally with a psychologist is we can find a different way to express that tic, that need, that brain overactivity.
Hi. Earlier in the presentation, we talked about different ways that ADHD presents through different phases of life. And the comment around college that oftentimes kids struggle because they've had somebody kind of performing that executive function for them. Can you talk a little bit about how parents kind of walk that fine line of trying to make sure that we are structuring things to make sure the kids can be successful versus trying to set them up for success? I have an 8-year-old daughter who has ADHD who tries. She's very smart. She goes out of her way to make sure that other people will do things for her and tries very hard to act like the baby and is not at all looking to be independent. And I, want to figure out how to best help her.
Sure. So it really is the fundamental question of all parenting, though, isn't it? Am I doing something for you that you can really be doing yourself? Wait a minute. At what point can I say, no, you can really do this yourself? So with an 8-year-old, you want to start thinking proactively, and you want to start thinking about what are the things that I want to be shaping in terms of a level of independence. I want to jump to the beginning of the question, though, and I want to make a point about college. Going away to college is not for everyone, and it's okay for your child not to go away to college. No one tells parents that. I don't think it's told to them enough. It's perfectly fine if your child stays home for a year or two and you continue to do the supports while you're weaning them off of you. There are also colleges that will provide a lot of supports, especially if you have a diagnosis of ADHD. So there are some colleges that will provide for your child everything from 2-3 times a week check-ins to tutoring in every class, to guidance over how to break down a chapter and take notes on the chapter. So you can get a high level of support, you can get a moderate level of support where you just have a coach you're checking in with once a week, and maybe you're living in group housing where you're being checked in on more frequently, to a very minimal level of support, which you might not even need a diagnosis for. You can just go for tutoring and check in with an ADHD coach every other week. So first of all, don't set your goal on preparing them to go to college at 18. Barkley, who is an expert in ADHD, will say you need to think of kids with ADHD as having about a 30% delay. So I don't know math really well, but at 18, we got to be thinking about them like, 12? 13-ish? Would you send a 12 or 13-year-old to live on their own independently? 15, whatever that math is. Ish. I said ish. Right. Good enough. Divide by 3, carry the 2. So bottom line is that first and foremost, just because your child has crossed the threshold of a high school gymnasium and been given a piece of paper and moved their tassel over doesn't mean that they're ready. And that's okay. And there's a lot that we can do at that point. To the underlying meat of your question, which is, oh goodness, what can we be doing proactively now to help them? First and foremost, especially at age 8, we build the adults around the child. Build the adults around the child. We introduce strategies, and then we teach the adults how to prompt those strategies. So for example, you will be eternally frustrated if you're saying to your child, it's time to get ready for bed, go get ready for bed. What you'd want to do is make a picture list of the 5 different things that your child needs to do to get ready for bed. Yes, she's 8 and she should be able to do this on her own, or yes, he's 12 and he should be able to do this on his own, or yes, he's 17 and he should be able to do this on his own, but he can't. Okay. Move away from the should and move into the reality. So you make a picture list, you put it on the mirror in the bathroom, and you say, sweetie, it's time to go up and do your picture list. It's time to go up and do your list. Come on, let's go upstairs, we're gonna do your list. So you're putting the strategy in place and you're prompting its use. And then eventually over time, those strategies will become internalized. But the things you wanna make sure at these young ages is that you're getting the adults to buy in and you're getting the adults to provide the prompting. There's not a whole lot that you can do to sort of fast forward the brain development. So I think of it like this. If there was a child in a wheelchair and I were to say to her, get up. You know, come on. Everybody else in the class is running a mile. Everybody else in the class can do it. We've talked about it. We've read books on how to run a mile. We did an anatomy chapter on the muscles of the lower extremities. All the other kids in here can do it except you. What is your problem? Get up and run a mile. That's ridiculous because the requisite physiology isn't there. Oh. The requisite physiology isn't there for the executive functions either. It's the same rationale, we just can't see it. So to try to put things in place to get those, to ensure that those independent life skills are going to be there by 18, it might not happen. What we need to do is we need to externalize. And I'm not saying we do it for them. We put the strategy in place, and then we prompt the use of that strategy. So pack for school in the morning. Here's the checklist. We're going to put the checklist next to the door. I'm not going to pack you for school in the morning, but I'm going to say, did you do your checklist? And we're going to learn that checklist, and we're going to train on that checklist, and I'm going to reward you for that checklist. You're going to earn $1. You're going to earn time on your iPad, whatever it is, until you've internalized the ability to use the checklist. And then all I'm going to say is, checklist. Hey, checklist. So you're still involved, you're still cueing, you're still prompting, you're still putting the supports in place, but you're not doing it for her. And then you're gauging, and then at 18, if you think she's gonna go to school and she's gonna carry her big backpack full of checklists, awesome. But I would just set them up for success by having a lot of supports in place at that point.
Do we have any other questions? We have about 5 minutes.
Thank you. So I have a 5-year-old kindergartner going on 6. His pediatrician has pretty much concluded that he does have the ADHD diagnosis. I kind of, sort of as the parent, because he's 5 and a boy, kind of just not jumping the gun towards diagnosis because he was 5, he's a boy, so you just automatically assume that's just boy behavior. But my concern is in school. The school he's attending, they're not very well versed in the ADHD diagnosis currently. And it's not that they don't want to assist or help him. We pretty much, as the parent-teacher team, don't know where to start.
Sure.
So as the basis, where do I start? What questions do I ask? What do I present to them? Because he did have something occur yesterday, and they're calling, of course, and they're just like, okay, we need to get together.
What do we do? Sure.
A kindergartner, where do you start?
Has he been evaluated? Has he had any testing done?
He's had testing. We are currently trying to start the behavior treatment of it and picking a psychologist for the behavioral treatment. But in the meantime, he's disrupting class sometimes. His issue is certain tasks, so sitting during writing, or moving on to the next class, he kind of has these spells where he just starts crying and gets bad anxiety, and they have to kind of pull him into the principal's office.
Is he in a public district?
He is.
Okay. So what we like to see, do you have anything to add? You have something to start with on this, because you have more school experience than I do.
Well, does the school team not know how to provide any support for him? Is that what you're asking about, and how you can have a conversation as a team on how to support your son?
Yes, it's kind of new to them. Not in a way of they've never dealt with it, but the school is more built on the discipline aspect of the schooling. And me as a parent, I am researching other schools, because at this point I don't think it's the right motto for him. But until then, just giving his teachers some steps or a basis of where we can start to begin to, first of all, make it more comfortable for him so he's not exhausted at the end of the day and and not wanting to go to school. And then for her, she has 14 other children in the class as well.
I'm thinking like
so
a functional behavioral assessment first.
Right.
So what schools can provide and what you are allowed to request is they will do a functional behavioral assessment. What that means is they will observe your child, and they will, through systematic, research-based strategies and tools and methods, watch your child and watch when are the periods of time where the incidences are most likely to occur. And it's number-based, and they have stopwatches, and they're circling things and whatnot. And then that evaluator, the functional behavioral assessment, the person who does that, has recommendations for ways that we can avoid these instances in the future. So there's if you look on your handout, let's give you a number. It's number 14 of mine. For those of you at home. I think I'm past it. Yeah, nope. So for slide 14, this is about behavior modification. And so these are the ways that we train kids to do more of what we want to see and less of what we don't want to see. And it's not, and so the first thing you might want to do, I put together how to put together a good behavior management plan, a good behavior plan. I made a handout, and it's available in the back. Take a couple extras, share them with the teachers. Again, the goal is to get the child to do more desired behavior and less undesired behavior, using rewards as much as possible. But here's what a functional behavioral analysis does. And for those of you who are thinking about this can be done at home as well. It doesn't have to be super sophisticated. So we want to think of the ABCs. A, what is the antecedent? What led up to this push in the hallway? Like, what were the things that were going on? I bet if you ask him, he'll either say, I don't know, or he'll tell you, somebody said something to me, or this happened, or somebody bumped into me. So the antecedent, what led up to this? What happened just before the incident? And then the behavior. What did the child do that is the problem? And then the consequence. What happened after? So in other words, if somebody bumped into him and he pushed that kid, his assumption is that kid's not going to bump into me again, right? So us as adults try to get in there at the A. And we try to get in there and we try to prevent it from happening in the future. And then we try to manipulate those consequences, meaning that if something good came of it, so I sucked my thumb and I feel less anxious, so I'm going to suck my thumb more often. We can find a way to give the child the ability to be less anxious in a different way. So a good behavior plan involves knowing what led up to the behavior and then what happened after the behavior. And the schools know how to do this. And I would also encourage you to know your rights and maybe even think about talking to a parent advocate, because there is not a school district in the suburb of Cleveland, Ohio that doesn't have at least 5 kids with ADHD. I mean, it's anywhere from 3 to 10% of the population, so your child is not the only one. But that would be a good place to start.
Okay, I think, sure, a follow-up, okay. Oh, could we get a microphone? Sorry.
I just wanted to try to help her out. Is every school required to have someone on staff to be able to perform those types of evaluations?
Functional behavioral analysis?
Yeah,
Yeah.
every school has to have a school psychologist. Every public school has to have a school psychologist on staff and available, and every school psychologist should be trained in how to do a functional behavioral assessment. It's basic principles 101 that they would know how
Yeah,
to
they
do.
learn it like their first year of grad school. So, and if they can't, they're obligated to find someone who can.
Who can.
So,
Okay. Sure. Sure.
oh, neat idea. Aw, Doug.
Oh my. Wow. I feel like.
Thank you, ladies.
Sure. Well, that was a great. That was a great way to end our program. I
was
don't know if I want
perfect.
to follow that act. Okay, so it is time. Our breakout session is over. I just wanted to take a moment to thank Dr. Chase for taking time out of her busy schedule to be here with us
Thank you
this
for
evening,
having me.
as well as Dr. Gersovic. Thank you. Thank you. I also want to thank the Bicknell Fund for continuing to support our community education events. So if we could give them, oh great!
Thank you.
And Renee Lewis is not in this room right now, but she put together this event, put together the handouts that you see. So I'd like to thank her as well, even though she's not in the room, as
you,
well as our
Renee.
SAS department, who put together a handout. I don't know if you saw it on the table for different, oh, I see. We have some of our SAS department here. Dr. Brown Triolo. And they put together a wonderful handout for us on different supports for executive functioning. And you can find that out at the
There's
the
websites
table.
and apps and all sorts. It's an incredible resource, and they're talking about having this updated so that it's available electronically. So, in other words, the apps and the technology tools and things that are available today are obviously going to change. And so, even though you pick up a paper copy, you can still reference this on Lawrence's website, and it will be updated.
I have two quick reminders before we end. If you could fill out the evaluation form that you received at the beginning of the evening and return it to one of our baskets in here or outside. If you did not get a form, there are some available on the table outside as well. If you are a professional and need documentation for attending the event, you can find that outside on the table as well if you have not picked it up already. Okay? Sure. Yes.
Super.
Yes, and I just want to conclude by saying thank you for coming. Thank you for taking time out of your schedule and evening as well.
Have a cookie on the
thank
way
you.
out, please.
Yes.
'Cause the last time I must have taken 100 of them home.